Welcome to Community Health Heroes, where we spotlight local leaders and organizations that provide much-needed health and wellness resources and information. Our hope is for everyone in our community to strive to live healthier, happier, and longer lives. I'm your host, Leslie Snedowski. Thank you for joining us. About 85 million adults in the United States have high blood pressure, but they can start getting it under control by simply taking a walk. Coretta Lagarde, the Senior Director of Community Health and Stroke for the American Heart Association, will tell us about the recent Target BP Mini Health Fair in Duncan Plaza at the United Healthcare Walking Path. We'll learn more about the program, more about the importance of walking to lower blood pressure, and where the United Healthcare Walking Paths are in New Orleans. The Daughters of Charity Health Centers and United Healthcare just launched a new partnership aimed at providing greater access to healthcare and social services. Mike Griffin, the President and CEO of the Daughters of Charity Health Centers, and Allison Young, the President and CEO of United Healthcare Community Plan of Louisiana, will tell us about the CARE Fellowship Program designed to help the underserved community by training and deploying new full-time community health workers. In our Community Health Heroes report, we'll go to the Grodat Youth Farm in City Park. There, we spoke with Louisiana First Lady Donna Edwards, who announced that 16 Louisiana schools and youth organizations were going to receive $40,000 in United Health Foundation and Whole Kids Foundation grants to provide educational resources about agriculture and nutrition. And in the kitchen, for our Eat Fit NOLA cooking segment, Chef Camden Richardson of Sola Deli in Auction House Market will show us how to prepare infused olive oils used for salads and dipping sauces. It'll be a tasty segment for those of us who enjoy great dressings, but without the extra fat and calories. We'll be right back with more Community Health Heroes.
This is what high blood pressure looks like. Talk with your doctor to create a treatment plan that works for you. Go to loweryourhbp.org.
Welcome back to Community Health Heroes. Did you know high blood pressure is a contributing factor to major health conditions, including heart attack, heart failure, stroke, and kidney failure? According to the American Heart Association, it's estimated that high blood pressure costs the country about $48.6 billion each year. Joining us now is Coretta Lagarde, the Director of Community Health and Stroke for the American Heart Association, to talk about how walking can help us control our blood pressure levels. Great to see you again, Coretta. Thank you for stopping by today.
Thank you so much for having me, Leslie.
So I want to hear all about the Target BP Mini Health Fair in Duncan Plaza at the United Healthcare Walking Path.
We held the Move More Month Walking Path Health Fair in conjunction with the City of New Orleans, United Healthcare, and many other providers. So this event is really to help encourage people to get out and get active and move. And so any way that we could do that is how we began to insert ourselves. So we held the fair, we had vendors from across the city to attend and participate. In addition to that, the New Orleans Arts Council also had entertainment and yoga to be done during that hour break. We also walked around the United Healthcare Duncan Plaza's walking path, which was really fun and got us out and moving as well.
So how does Target BP help the medical community too? Because I know they also obviously have a lot of outreach to help people get them to start walking, but they also help the medical community, right?
Right. Target BP is a national initiative really to help to change the health and care of patients in any of the healthcare settings that we work with.
How does a Target BP program work?
Well, with Target BP, as you know, most physicians are quite aware of their ability to take care of the patients in their setting, but we still have many individuals having high blood pressure and receiving high blood pressure on a daily basis. And so what Target BP does is take the guesswork out of a doctor's visit. So they're able to actually use the resources and the tools that the American Heart Association and American Medical Association provides in order to give them guidance on whether it's algorithms to check their health, map tools in order to measure blood pressure accurately in each and every patient. So this is working with not just the physicians, but all the way down to the nurses, the medical assistants, and the people that are greeting them at the front desk.
So we've established that walking helps to lower blood pressure. So tell us a little about these United Healthcare walking paths. There are a few in New Orleans, right?
Yes, there are 4 designated United Healthcare walking paths. So there's the one at Duncan Plaza, in which we mentioned about Move More Month event. There's also one in Lafayette Square, Palmer Park, and West End Park that is designated by the American Heart Association as a United Healthcare walking path. We also have the United Healthcare app, which is www.uhcwalkingmaps.com, where you can actually take a look at the walking paths across the city. Beautiful city of New Orleans. You're able to go outside and enjoy the fruits of our labor, so the architecture, all of the festivals that we have, and so we really do appreciate having the walking paths and the guidance of United Healthcare for doing that.
And how can our viewers learn more about Target BP? Where can they go?
So for our viewers, we have a website which is loweryourhbp.org, where anybody can go, any patient can go, any person can go to get more information about your blood pressure. And then for clinics and physicians and healthcare practices, we do recommend that you go to www.targetbp.org to get more information on how your facility can be a part of the program.
Greta, thank you so much for sharing all this valuable information. It actually sounds like it could be fun to lower your blood pressure with all these fun walking paths.
Yes, walking is actually a fun activity you can do at any time, in any place, and also just to take care of your nutrition and your diet and go to see your doctors.
Great. Well, again, thank you so much, Greta.
Thank you.
When we return, the latest about a new partnership aimed at providing greater access to healthcare and social services in our area.
When I was 6, my mom had a stroke.
I'm Paul George. Learn the signs of a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Spot a stroke fast.
Did you know Daughters of Charity Health Centers of New Orleans has provided compassionate health care in New Orleans for 180 years? Daughters of Charity Health Centers of New Orleans offers primary and preventative health services at 10 health centers throughout New Orleans, dedicated to addressing the needs of the total individual, body, mind, and spirit. Joining us now are Mike Griffin, the President and CEO of the Daughters of Charity Health Centers, and Allison Young, the President and CEO of United Healthcare Community Plan of Louisiana, to tell us about their new Care Fellowship program. So excited to have you both here with us today. Thank you for coming.
Thank you for having us.
I'm excited. This is a great opportunity.
Well, I'll talk about being excited. This partnership sounds totally game-changing. So the partnerships between Daughters of Charity, United Healthcare. Allison, tell us what this is all about.
The Daughters of Charity Health Center Care Fellowship Program is made possible through a partnership funded by United Healthcare.
And Mike, tell us a little about what this Care Fellowship Program will do for people in New Orleans.
Yes, the Care Fellowship Program will help us to staff community health workers and case managers that will go out and work with thousands of underserved and uninsured in our community. We will conduct health screenings. We will also be connecting individuals to resources, things like financial counseling, food insecurity issues, housing, educational issues, those things that really impact a person's health, but is not necessarily health care. We'll also be focused on primary care and prevention, getting individuals into a primary care patient-centered medical home to help improve their health status.
Allison, why do you think United Healthcare felt New Orleans was the perfect place to engage in this program?
Well, as you know, United Healthcare publishes America's Health Rankings, and Louisiana is number 49 out of 50 states. Therefore, focusing on Louisiana is the right place. But in addition, New Orleans is the largest city in Louisiana and has a very large underserved population. Therefore, it was an easy choice to pick New Orleans to start this program, and we're really excited about its potential.
Talking about its potential, Mike, I know that you're focusing on social determinants because they're very important to health. You touched on it a little bit, but can you explain a little more about that?
Yeah, social determinants of health really are those issues, environmental issues, that really impact a person's life. Probably 80%, upwards of 80% of what impacts a person's health care is not health delivery itself. It's other activities or engagements, such as a person's diet, their nutrition status, their income, their housing status. And so our community health workers will be working with individuals to really look at those issues that impact our underserved, uninsured patients and community residents, really to impact upstream issues that will impact their health later.
So you're really focusing too on like their environment, not like you said, not their health conditions, but their environment they're living in to try to help them with issues there, right?
Correct. It's a holistic approach to really solving the healthcare issues and improving the health status of our community.
Is this one of the reasons why United Healthcare chose Daughters of Charity, because they're really into the holistic approach?
Oh, absolutely. Daughters of Charity brings a whole variety of services. And by adding these community health workers, we are extending their reach into the community even better. You know, when you think about a condition like diabetes, there are conditions that diabetes will cause blindness, amputations, and if you are food insecure or housing insecure, you can't manage your diabetes, making it more likely that one of these really adverse consequences will occur. So by having the Daughters of Charity community health workers in the field, we can really address some of those issues early on before they reach a critical point.
That's a really good point. Mike, do you think when other organizations hear about this game-changing program, it might inspire them to maybe pony up a little and try to explore this type of program, and maybe with you guys or other organizations?
We certainly hope so, and we're so excited to partner with United, an agency or organization that's nationally recognized and has so many resources to work with us. So we would love for other insurance companies and agencies to do the same, be a part of a program that really looks at social determinants. But we are partnering with local agencies. So we'll be working with the local entities like Catholic Charities, Second Harvest, other health centers and hospitals in the community to coordinate services for the patient population.
And I also wanted to ask you a quick question about outreach. We talked a lot about the resources available. It's going to be finding these people that you want to help, right? Could you tell us a little about that?
Well, we'll be going out in the community. So we're not going to, these individuals won't be in the health centers or just in the walls of our clinics. They'll be going out into emergency rooms, community centers, churches, health fairs, doing things and screenings out in the community to really locate people where they are.
And I know our viewers will probably want to learn more about this because it sounds like a very big program with a lot of different facets. Where can they go to learn more?
Well, they can go to www.dcsno.org.
So thank you both so much again for joining us, and good luck with this program. It does sound very groundbreaking, and like you said, maybe it'll be a model for many other cities to follow.
Yes, indeed. We think it's going to be transformative. Thank you.
Thank you both again. When we return, we'll visit the Grodat Youth Farm, speak with Louisiana First Lady Donna Edwards, and learn why it's important to teach kids the value of vegetables in our Community Health Heroes report.
Hey, let's check out this park. Oh, wow, that's really cool. To find a great local park or forest near you, go to discovertheforest.org.
Did you know, according to United Health Foundation's America's Health Rankings, more than 1/3 of Louisiana children aged 10 to 17 years old are overweight or obese? Studies show that school gardening, combined with a healthy lunch program or nutrition education, encourages healthier food choices, and children are more likely to eat fruits and vegetables they have grown themselves. Thanks to the United Health Foundation and the Whole Kids Foundation, 16 local schools and youth organizations received $40,000 in grants for kids to get their hands dirty, learning about growing vegetables, eating fresh produce at salad bars, and tending to beehives. More about these garden grants and the Grodat Youth Farm in this Community Health Heroes report. Louisiana First Lady Donna Edwards took a tour of the Grodat Youth Farm in City Park in April to announce a $40,000 grant award from United Health Foundation and Whole Kids Foundation. Grodat is one of the 16 Louisiana schools and youth organizations to each receive a grant to build or expand existing vegetable gardens, salad bars, and beehives, and provide educational resources about agriculture, caring for the environment, and maintaining healthy lifestyles.
Well, it's important, you know, to see United Health Foundation come together with our Whole Kids Foundation to support Grodat is so important, and we should do this more around our state because, you know, when we bring our communities together, we can only be better. And to see them coming together and growing, you know, everything from carrots to celery to beets, and then having the young people come in and play a part in that, it's just so important on healthy living. We know that we have one of the highest obesity rates in the country, so, you know, it's important to teach our young people at such an early age where the food comes from, why it's important, and get them excited about it. Louisiana is known for its farming and its communities, and it's important to see businesses be challenged to come together and support programs like GrowDad. Nowadays more than ever we have so many budget cuts and so many things happening financially with different organizations. It's so important for our community to jump up and stand up and be involved in programs like GrowDad, and for United Health Foundation to come out and support their efforts and what they're doing at different schools and in teaching young people about the importance of good food and good eating and healthy eating is more important than ever.
GrowDad Youth Farm is located on a 7-acre site, and youth volunteers help grow and harvest an average of 25,000 pounds of fresh produce a year. 70% is sold at the GrowDad farm stand and at farmers markets, and the other 30% is distributed through its shared harvest program to low-income residents who otherwise have little or no access to fresh food.
The kids like to eat what they've grown, and they bring that home, and the whole family's talking about what they grew in their garden, and the whole family's eating what they grew in the gardens. And it's all the things that they learn about growing their own food, about sustainable gardens, about composting, contributing to the community. And this is a really great example of the community coming together to foster service as well as healthy lifestyles.
More than 70 kids participate in GrowDad's leadership and advanced leadership programs, where through training and experience, they learn skills related to sustainable farming, food justice, and community leadership.
These grants are basically an opportunity to support our young leaders through their growth and development process. A lot of the funds that we receive are for generally the leadership programming. What's special about these grants is that they focus specifically more so on our food justice project and also on our bees. We focus a lot on sustainability here, so having the bees here to encourage pollination, which then helps production, which then feeds our youth leadership programming. It's a really great way to kind of jumpstart all of our efforts and to really integrate all of the work that we do here.
After 15 years of smoking, Eva Marie quit. There's a new lung cancer screening that could save her life. You stopped smoking. Now start screening. Learn more at savedbythescan.org.
I'm Molly Kimball, registered dietitian and founder of Oxner's Eat Fit NOLA. We've collaborated with more than 100 partners locally to create Eat Fit NOLA, a partnership that highlights the better for you items right there on a restaurant's menu or on grocery store shelves, making it effortless for you to dine at your favorite restaurant or shop your favorite market without ditching your otherwise healthy diet. Every month, Community Health Heroes Show, which is sponsored by the United Health Foundation, will shine a spotlight on an incredible chef to help show you how you can make smarter food choices to live a healthier, happier, and hopefully longer life. In addition to Eat Fit NOLA, you can find our partners such as Eat Fit North Shore, Eat Fit BR, Eat Fit Bayou, and coming soon, Eat Fit Acadiana in a neighborhood near you. So don't go away, Community Health Heroes will be right back.
Organic basil and black pepper, ginger and chili pepper, and hibiscus and sage. Those are just a few of the flavor combinations of the homemade infused extra virgin olive oils you'll find at Sola Deli at Auction House Market's Food Hall at 801 Magazine Street. Today, Sola Deli's Camden Richardson will show us how to make low-fat and low-calorie dressings for our summer salads, and Eat Fit NOLA Ambassador Emily Eichhoff is here to tell us why they're healthy and what we should look out for or stay away from when we're buying and ordering our salad dressings and dipping sauces. So thank you both very much for joining us today.
Thank you for having us.
Thank you so much for having us.
So at Sola Deli, there are 2 Eat Fit NOLA approved salads. I take it these are the
These
salads.
are them, yes.
Tell me about them and tell me a little about the special dressings you use for them.
Absolutely. So on this side we have our Southwest salad. It is on a bed of red leaf lettuce. It's a combination of roasted corn, black beans, avocado, our pico de gallo, which we make fresh every day, a little bit of 4 chili cheese, and then it comes with our citrus vinaigrette dressing that we make in-house with some of our infused olive oil, which I'll show you in a second. We also have our superfood salad, which is on mixed greens with kale. It has edamame, sliced apple, roasted sweet potato.
Those look delicious.
Yeah, and a little bit of a spiced pepitas on top. And that comes with our our chili dressing, which is made with our urban chili olive oil.
So one of the things that makes Sola Deli really stand out are the organic extra virgin olive oils you prepare, but you start kind of with the olive oil and then you turn that into dressing.
Absolutely.
So take it away and show us the magic you do with all this stuff.
Yeah, totally. So we're going to make our citrus dressing today. It starts with a base of our basil and black pepper infused olive oil, which is an extra virgin organic olive oil from Spain. We mix that. This takes just a second, but I love using jars. I do this at home as well because you can actually measure while you're pouring.
It's very clever.
So smart.
It's kind of like a bigger mason jar.
Basically, yeah. And this way too, you can keep the dressing in here, and it makes it's a nice little hack at home to not have to dirty up too many utensils while making a dressing. So that's 1 cup of our basil olive oil. We're going to add a 1/4 cup of just red wine vinegar.
That looks pretty. I feel like a mad scientist.
All right. And then the citrus. So we have orange juice, fresh squeezed orange juice, a 1/4 cup of that. Wow. A 1/4 cup of fresh squeezed lime juice to give it that Southwest flavor. And then just some minced shallot.
This looks super easy. I mean, anyone can do this at home.
Oh, super easy.
That'd be fun too to create it at home and like give it as gifts. You know?
It
Yeah.
would be very special.
It's just real flavorful. It's so fresh, and it's nice that it works really well with some of the spicier components in the salad. It kind of balances out the chili cheese and the pico de gallo really well. And again, the best thing about this
Here's
is
the fun part. I'm moving away.
to emulsify, all you have to do is shake.
Awesome.
And you create a lovely dressing that you can pour and keep in the fridge for up to 2 weeks.
Look at that. And this is the dressing that you pair with.
Yeah, so this goes on the Southwest right here.
Stanley, tell us why extra virgin olive oils are so healthy for us and why people should really try to pick dressings with olive oil in it.
Definitely. So any of your plant-based oils are going to be really high in monounsaturated and polyunsaturated fatty acids, which are really good for heart health and brain health. They're also really high in antioxidants and things like that. So incorporating those into your salads is a really great idea to increase the nutrition.
Well, that reminds me too, I wanted to ask you about salads in general. I mean, a lot of people make this mistake. You prepare a salad at home, or you go to a restaurant and you buy a beautiful salad. You're like, oh, I'm going to eat this salad and not gain any weight, but you make the mistake by putting the wrong dressing on it. So tell us, how can people look out for that mistake, avoid it, and then seek out products like Sola Deli's dressings?
Definitely. So salads can be very tricky, and it's mostly the salad dressing that can really throw things off. So you get a really nice salad, 200 or 300 calories. Adding a standard ranch can make it up to 900 to 1,000 calories.
Oh my goodness.
So it really takes, you have a good intention and it goes out the window. On the other hand, you might want to avoid 0-calorie salad dressings as well, because they might have artificial ingredients, sweeteners, and flavors as well. I love things like this though. Like I said, they do have high antioxidants, healthy, heart-healthy fats, and things like that. So
can you break this down too in terms of like calories and fats and nutritional values? I mean, with the ingredients that Camden used.
Yes.
This looks pretty clean to me.
For sure. So per salad, the Southwest salad is a little under 500 calories, and the superfood salad is around 600. But as I mentioned, they are full of whole foods, plants, vegetables, fruits. You see the rainbow there. So those are some really great things you see when you see a salad.
So Camden, I know as a small businessman, you make a lot of small batches of your products, and you also use locally sourced ingredients. Can you tell us a little about that? Is that challenging to make small batches, or do you prefer that?
I actually prefer it. We have been making the infused olive oils in a line of seasoning and herb blends for about 3 years now. And we make them all in small batches to maintain integrity. The batches have grown over the years. We started off in literally mason jars, and now we make them in much larger tubs for sale and for use at the deli. But it actually helps us to ensure that we don't have to add chemicals or add additives or anything to them, because as we made them in larger batches, we would, in order to preserve them for longer. So we actually make it to what we have to sell, and that way we're not having to put anything in there that's not as good for you. So
do you find too there's like a big customer base for this, or a lot of customers looking for dressings with better ingredients and better nutritional factors?
Absolutely, and I think that we see that both at the deli and we do markets and fairs and festivals, because customers they come to us for our seasonings and for our oils because there's other things in the market similar, but maybe they have those additives or they aren't organic or there's elements to them that make them a little less healthy.
Also, tell us a little about your online store. I know I was looking at it, and there's a lot of things you sell in there. It looks really great for gifts as well.
Yeah, we actually have 6 flavors of infused oil in a couple different sizes, 14 different herb and spice blends, and then many combinations of those in gift boxes, packages. Mother's Day is coming up, so feel free to check it out for that. But yeah, we do a lot of gift buying, especially during the holidays. I think that people like to give something that is unique, locally made, well packaged, and obviously also good for you.
I was looking at the logo. I was very impressed. It's very cute. And SOLA stands for?
South Louisiana. So we try to be as local as we can to the state. We do source from other places, but we try to bring it back here, and wherever we can use something local or organic or all natural, we absolutely do, especially in our food at the deli.
And Emily, how did Eat Fit NOLA find SOLA Deli? How did y'all meet?
Well, Molly has actually known Camden for a while. I'll let you kind of take over.
As I mentioned, we do markets and things, selling our oils and spices, and Molly Kimball from Eat Fit does pottery as well on the side, in addition to her nutritionist job. We actually met at a market. We were both selling our wares for a holiday event and got to talking about Eat Fit and our stuff, and we did just announce we were opening the deli, so we kind of teamed up, and as I was finalizing recipes for SOLA, we made sure we made a few that we knew would be Eat Fit approved, and we're still working on a few more, so hopefully we'll have many more very soon.
And we're so lucky to know you because you've actually introduced us to the rest of the vendors at Auction House Market and are allowing Eat Fit to work with those vendors as well, so we really appreciate that. So.
And I also wanted to have you tell our viewers where they can find out more information about SOLA Deli. You have a couple of websites you can throw at us?
Absolutely. So we have soladeli.com is probably the main spot. You also can come by the deli at the Auction House Market. We have our entire line of seasoning and oils there, along with fresh prepared food for breakfast, lunch, and dinner. We're also in a variety of boutiques around town. So if you're out shopping about New Orleans, you'll probably see us in a few stores here and there and can pick your goods up there too.
And Emily, tell us too about Eat Fit NOLA. If people want to learn more about your program, where can they
Yes, the viewers can find all of the nutritional information about these salads on our app, which is also a great resource to find any other Eat Fit NOLA restaurants around you, or you can always go to eatfitnola.com and find more information.
Well, great. Well, thank you both for joining us today. That was really impressive to watch you do that little shake. And we're also going to be putting some of your information on our Facebook page and, of course, at communityhealthheroes.org. So thank you both again.
Awesome. Thank you.
Thank you so much.
We'll be right back.
Is your family in need of more quality time together?
Hello, I'm Dr. Spruce. Nature is best enjoyed together. So bring the whole family to discover all the bonding and stress-reducing benefits parks and forests have to offer. Visit discovertheforest.org and trade in phone time for family time.
Birds, squirrels, chipmunks, grass, worms, bugs, trees, rocks, and other objects in nature cannot talk. If you'd like to have a conversation while visiting nature, you will need to bring humans along. We strongly recommend starting with your family.
It takes less than 1 minute to find out if you may have prediabetes, and you can do it here. So what are you waiting for? Just go to the site.
Thank you for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com. If you'd like to learn more about our guests and share segments from our show, check out our website at communityhealthheroes.org, and you can also find our show on YouTube. We hope the information we've provided you about Target BP and lowering your blood pressure, the new Care Fellowship program to help thousands of underserved people in New Orleans, how learning about gardens at a young age will help kids eat healthy as adults, and where to get and how to make healthy salad dressings will help you and your family live healthier, happier, and longer lives. I'm Leslie Snedowski. Make sure to join us next time for more Community Health Heroes.